Hello and welcome to my channel. In this video, we will discuss about pneumonia. These are the basic topics that we will discuss in this video. So let's start. So first of all, I would like to discuss what exactly is the meaning of pneumonia. So pneumonia is an infection of lungs which is caused by bacteria, virus and fungus. The infection leads to the inflammation of the alveoli. Among virus and bacteria and fungus, virus and bacteria are highly contagious. They can spread from one person to another through inhalation of the air droplets or from sneezing or coughing. So this is the exact meaning of pneumonia. Now next we'll talk about the pathophysiology of pneumonia. So let's talk about the pathophysiology of pneumonia. So microorganisms gain its entry into the lungs by three ways. Firstly, by inhalation of the microbes which are present in the air. Secondly, by aspiration of the organisms from nasopharynx or oropharynx. And thirdly, through hematogenous spread. And once the viruses, bacteria enters into the lungs, then inflammatory responses get started, which leads to the inflammation of the air sacs which are called alveoli. And when the alveoli become edematous and they get filled with pus, so alveoli and respiratory bronchioles fills with serous exudates, blood cells, fibrin cast and bacteria, then consolidation of the lungs tissues will take place. This will result into increased production of the sputum and hence purulent sputum will be produced. So this is the complete pathophysiology of pneumonia. Now next we'll talk about the broad classification of pneumonia. So as you can see here on the screen, this is the broad classification of pneumonia. So pneumonia has been divided or has been classified on the basis of anatomical reason, on the basis of clinical reason, on the basis of etiology or pathology. So you can see here, this is the broad classification of pneumonia. Now one by one we'll discuss this with you. So firstly, I would like to discuss classification of the pneumonia on the basis of clinical trial. Okay, so on the basis of clinical, pneumonia has been classified into community-acquired pneumonia, nosocomial pneumonia, which is also called as hospital-acquired pneumonia, ventilator pneumonia, and aspiration pneumonia. So first of all, we'll talk about what is community-acquired pneumonia. So this refers to the pneumonia that is acquired from outside localities. Secondly, what is nosocomial pneumonia? So this pneumonia is acquired from hospitals and it is more serious, or you can say it is highly dangerous, because as the bacteria involved may be more resistant to antibiotics. Now next we have ventilator pneumonia. So people who are using ventilators get this type of pneumonia, and one more type of this is there, that is aspiration pneumonia. So inhaling bacteria from food, drink, saliva into your lungs is called aspiration pneumonia. So this was a classification of the pneumonia on the basis of clinical. Now next we'll talk about the classification of the pneumonia on the basis of anatomical reasons. So you can see here, on the basis of anatomical reasons, pneumonia has been classified into bronchopneumonia, lobar pneumonia, and interstitial pneumonia. Okay. So first of all, I would like to discuss what is lobar pneumonia. Okay, let's talk about it. What is lobar pneumonia? So lobar pneumonia is an acute bacterial infection of the entire lobes of both the lungs. Now what are the main causes which are responsible for lobar pneumonia? So they are pneumococcal pneumonia, staphylococcus, streptococcus, klebsiella, pseudomonas and haemophilus influenzae. Now next, very important, we will discuss the 4 stages of progression of lobar pneumonia. So in order to make it more understandable, I have made a I have made a very beautiful mnemonic in order to remember the stages of progression of lobar pneumonia. So you can see here the mnemonic: cough relieved by giving Rumax. C stands for stage of congestion, R stands for stage of red hepatization, G stands for stage of grey hepatization, and R stands for stage of resolving. Now one by one we'll discuss all these stages. So let's start with the first stage of lobar pneumonia, that is stage of congestion. This is also called as initial phase of lobar pneumonia, and this phase lasts for about 1 to 2 days. Now what happens in this phase? Lungs appear heavy, they become congested, enlarged, dark red and blood-stained frothy fluid can be seen. Okay, now next stage, that is stage of red hepatization. This stage is also called as early consolidation. This stage lasts for about 2 to 4 days. Now what happened in this stage? Lobes is firm, consolidated, they appear red pinkish, dry and have river-like consistency. Okay, now next stage, that is third stage of lobar pneumonia, that is stage of grey hepatization. This stage is also called as late consolidation, and this stage lasts for about 4 to 8 days. What happened in this phase? Lobes is grey, firm and very happy, dry, greyish in color. Okay, and we can see the fibrinous pleurisy. So this was the third stage. With this picture it becomes very clear the stage of grey hepatization. You can see here, this is the stage of grey hepatization in lungs. Now next is the last stage of lobar pneumonia, that is resolution. Now what happened in resolution? So this stage lasts for about 1 to 3 weeks. In this, lungs appear greyish, reddish, brownish, frothy, yellowish, creamy fluid can be seen in this. Okay, so these are the 4 stages of progression of lobar pneumonia. I hope they are very much clear to you guys. Now next we'll discuss about the bronchopneumonia. So what is bronchopneumonia? So bronchopneumonia is also called as lobular pneumonia. What happened in this phase? So it is infection of the terminal bronchioles that extends to the surrounding alveoli and result in patchy consolidation of the lungs. Now next type is interstitial pneumonia, or you can say pulmonary fibrosis or scarring. So what happened in this phase? Lung disease. It's a kind of pulmonary fibrosis. It's a kind of lung disease that occur when lung tissues become damaged and scarred. And when they become scarred, so scarring make tissue stiff, which cause breath difficulty, and hence person may feel dyspnea, that is difficulty in taking breath, and coughing. So this is interstitial pneumonia. But another type is also there, that is fungal pneumonia. So this occurs in immunocompromised patient, and the main fungus which are responsible for this type of pneumonia are Aspergillosis, Mucormycosis and Candidiasis. Another is all about the broad classification of the pneumonia. I hope this is clear to you guys. Now next we'll talk about the risk factors. So let's talk about the risk factors which are responsible for pneumonia. So in order to make it understandable, now again I have made a very beautiful mnemonic for the risk factors. You can see here inspiration. So let's talk about the risk factors in the form of mnemonic. So I stands for immunosuppression, N stands for neoplasia, and S stands for secretion retention, P stands for pulmonary edema, I stands for impaired alveolar macrophages, RTI priors, A stands for antibiotics and cytotoxins, T stands for tracheal instrumentation, IV drug abuse, O stands for other, that is general debility and immobility, N stands for neurologic impairment of cough reflex, for example NMJ disorder, that is neuromuscular junction disorder. Okay, so these are the risk factors for pneumonia. The next very important, that is what are the clinical features of pneumonia. Now we'll talk about the symptoms. So first and the foremost symptom of the pneumonia is cough with sputum, or you can say phlegm. The next, shortness of breath, that is dyspnea, pleuritic chest pain and hemoptysis. Next is high fever, chills, person will be having headaches, loss of appetite, mood swing, skin will be clammy and bluish in appearance. There will be low blood pressure, that is hypotension, and high heart rate, that is tachycardia. If we talk about the gastric system, then nausea and vomiting will be there. There will be pain in the joints, fatigue in the muscle, and muscular ache will be present. So these are the clinical features. Next we'll talk about the investigations, that what are the ways investigations that one can perform in order to diagnose whether they are really suffering from pneumonia or not. So first and the foremost investigation is chest x-ray, then blood culture, then sputum culture. The next is pulse oximetry, CT scan, fluid sample, and bronchoscopy. Okay, so these are the various investigations that one can perform in order to diagnose whether they have pneumonia or another kind of disease. Okay, this was all about the investigations. Now, very important. Now, here we will discuss about the homeopathic treatment for pneumonia. So, what are the base homeopathic medicines which has been successfully used for the treatment of pneumonia? So, let's talk about the homeopathic approach now. So homeopathic treatment for pneumonia is very beneficial for affected patients. These medicines help in providing symptomatic improvements from pneumonia and resolve the inflammation of the alveoli of the lungs. In each case of pneumonia, homeopathic medicines need to be carefully selected based upon the individual symptomatic presentation. When prescribed as per the prominent symptom, homeopathic medicines have the ability to help in complete recovery from pneumonia. So let's talk about the homeopathic medicines. So first and the foremost homeopathic medicine that you can see here on the screen is Brineia. So Brineia is a top grade homeopathic medicine for pneumonia with a chest pain. So let's talk about it. So Brineia works well when chest pain accompanies with pneumonia. The pain is stitching in nature. Chest pains get worsens on coughing and deep breathing. While coughing, the patient need to hold the chest because of the intense pain. Expectorations of rust or brick-colored sputa is another characteristic feature. Along with this symptom, there is a difficulty in breathing and there may be fever accompanied by chills. Now, second medicine for pneumonia is arsenic album. So for pneumonia with difficulty in breathing, arsenic is an excellent medicine. Along with this, cough with scanty frothy sputum is present. Arsenic album is an effective homeopathic medicine for treating pneumonia from consuming chilled food items. Pain located especially in the upper third of the right lung is another guiding symptom for the use of arsenic album. Another feature is a suffocating feeling, which get worse on lying down or while sleeping. The next medicine for pneumonia is phosphorus. So for pneumonia with the chest operations, phosphorus is indicated for pneumonia when accompanied by chest operations. There is a heaviness in the chest and respiration is also quickened. There is also a dry, hard, racking cough. Along with this, bloody or the purulent sputum may also be occurring. Phosphorus is very suitable for pneumonia of the left lower lung. In such cases, lying on the left side worsens the symptom. The next medicine for pneumonia is entim-tart. So for rattling mucus in the chest, entim-tart is a very excellent medicine. Lungs are full of mucus which is not expectorated. Short and difficult breathing accompanies this. Antimony-tart work well in the last stages of pneumonia. Another important indication for using entim-tart is the occurrence of jaundice with pneumonia. Now our next medicine for pneumonia is Hipersulf. So for purulent sputum, Hipersulf is a highly effective medicine for pneumonia when the sputum is purulent. The pus in such cases may be very offensive. So Hipersulf is basically a homeopathic medicine for pneumonia in the suppurative stages. There is a loose cough. With rattling of the mucus. Patient needing Hipersulf may have a fever with chills accompanying the above symptoms. Now next, Last but not the least, that is ipecac. For pneumonia accompanied by nausea and vomiting. Ipecac is a good treatment for pneumonia in cases where nausea and vomiting accompanied other respiratory symptoms. The respiratory symptoms include suffocating loose cough without expectorations, shortness of breath, constriction in the chest. The cough is spasmodic and often ends in vomiting. Along with this, bubbling rales in the chest are present. Bloody sputa may also arise. So these are the top homeopathic medicines which has been successfully used for the treatment of pneumonia. So with this, we end here. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and thanks for watching this video.